So let's start with talking about drug names. And this is a little table, it's out of your book, and we have a list of some chemical names, their associated non-proprietary names, and then proprietary or trade names. So a chemical name, this first drug is D-alpha amino P hydroxybenzyl penicillin trihydrate, otherwise known as amoxicillin. We don't use that chemical name, but chemists and pharmacists do, and you should be aware that there is a chemical name that describes the chemical formation of a drug. We're going to use non-proprietary names. We can also call these generic names. Amoxicillin is a generic name. It is sold under a proprietary or trade name, and it's proprietary because different drug companies have the exclusive rights to sell a drug under their particular trade name. So the trade name will be capitalized, as these are Amoxidrop, Biomox, and Robomox 5. And you'll also notice that they have a little trademark symbol at the end, and it just means that that's a trademark name only they can sell. Only the company that is selling it under that name can sell it under that name. So the names that we're going to use are going to be the non-proprietary name for the most part. That's what I'm going to have you learn drugs under. There will be some where I need you to know some of the proprietary names for them. But for the most part, we're going to use the non-proprietary or generic name of drugs. So the term generic also has a significance in that when a drug is first being developed and studied to be brought to market, a company will get the exclusive rights to sell that drug for a period of years. It's usually about 20 years. It will take them millions of dollars and potentially, 5, 10 years, somewhere in there, to bring that drug to market, to get it um, past the FDA and manufactured, get it into a manufacturing process and have it be sold. Um, so usually the company will have 7 years of exclusive rights to sell that drug. They can name their price. They have spent a lot of money bringing it to market, so that's why they get that exclusive right. After that time, what are called generic equivalents can be sold by other companies, and they will have their own trade names for them. You may be familiar with Rimadyl. Rimadyl was developed in this country by Pfizer Pharmaceutics and was sold exclusively by them for a number of years. And now we have some other generic equivalents. It's sold under Carprofen, and there are some trade names by other companies for that, but the generic name is Carprofen. So that is the difference. The generics are usually cheaper because once we have some competition in the pricing, then the costs come down, fortunately. Some other terms you need to know are dose and dosage, and we'll talk about this some more as we're calculating drugs. But the dose is an amount, and it's given in terms of mass, so something like milligrams or grams, that we're giving to an animal at a single point in time. So if I tell you, you need to give that dog 2 doses today, maybe it's 6 in the morning and 6 at night. Those are a discrete amount that you're going to give to that animal. We calculate the amount for that particular animal based on a dosage. A dosage is an amount of drug per weight of the animal. It's going to be a weight that we're giving. Remember, an amount of mass, so milligrams, grams, that kind of thing, per kilogram of body weight of the animal, pound of body weight of the animal. So we use that to calculate the amount in milligrams or grams that we're going to give to the animal. We'll cover this a lot in calculating drug doses. So just want you to be familiar with these two terms. For the most part, we're going to give prescription drugs to animals from your clinic. A prescription drug is a drug that needs a prescription from a veterinarian. In order to prescribe a drug for a particular animal, the veterinarian needs to have seen the animal. There needs to be what's called a veterinarian patient client relationship. Very important to note, if an owner asks you as you're handing them the dewormer for the cat that came in with a lot of worms, um, if the owner asks you, tells you we have three other cats, can you give me something for them? Um, unless they've been seen recently, the veterinarian should be wanting them to come back in. And it's better to have them come back in. There needs to be that recently seen and examined animal in order to prescribe. Sometimes we send owners for over-the-counter drugs. This is not that usual, and I would say in the clinics that I've worked in, we've typically had over-the-counter drugs there that we hand to the patients the clients, because we want them to get the right drug. If we send them to a drugstore for an over-the-counter drug, you just never know if they're getting the right thing. But over-the-counter drugs are ones that we can buy in the pharmacy or the drugstore, just right off the shelf. It's ibuprofen that we reach for our headaches. It's those cold medications. The basic idea behind the differences of these drugs are that prescription drugs have more potential harm with them. An animal may need to be healthy. There may be some conditions that if they have them, we don't want the animal to have that particular drug. Over-the-counter drugs are generally safe for most um, humans because that's who they're intended for. So they're a bit safer. They definitely can do harm, but that's the other big difference, is that prescription drugs tend to have more harmful or particular things about them that need an animal or person to be examined. There could be a potential for abuse of a drug, and that's why it's prescription as well. And so those are the main differences between a prescription and an over-the-counter drug. I am going to go through the dosage forms pretty quickly, but a dosage form will dictate pretty much how we're giving something. And your book goes into details on these, and I'm just going to kind of hit the highlights here. So a solid form, these are usually things that we're going to have an animal swallow. So a tablet, a caplet, which is a capsule-shaped tablet, molded tablets. If you give your dog HeartGuard, they get a tablet that is molded into a rectangle and has a flavoring in it. And so aside from the drug that's in these tablets in solid forms, there are inert ingredients or inactive ingredients, which are called excipients. They just allow the solid to be formed into a large enough thing to handle and to keep stable in order to give it to the animal. Some tablets have coatings, and an enteric coating protects the drug from the tablet from being dissolved in stomach acid and allows it to get into the intestinal tract where most drugs are absorbed. Sustained release, we don't use a lot of these in veterinary medicine. They're typically designed for people, and the human intestinal tract transit time is different than cats and dogs and other animals. But there are some drugs that we will give as a sustained release. It just allows us to give it less frequently. Gel caps are softer capsules, just allows them to be swallowed easier. Capsules are capsules. They're in a gelatin coating that dissolves. We do not use these last two, lozenges or troches, in animals because they're meant to be held in the mouth and dissolve slowly, but just wanted you to be aware of those solid forms. Liquids are ones that we either inject, we can also give these orally, or we can rub them into the skin, drop them in the eye, in the ear. If they are water-based, we call those aqueous solutions. Other mediums that drugs are dissolved in to form a solution, maybe alcohol or oil, that kind of thing. And it just depends on the characteristics of the drugs as to what they are dissolved in. Suspensions are liquids that we need to shake up. They will settle with time. Syrups are a sweetened base that a drug is dissolved in, and sugar actually acts as a preservative, and it makes it easier to get the drug in, right, if you're going to have someone swallow it. But xylitol is an ingredient in some syrups these days, and we need to be very careful with that ingredient because it's just a sweetener. It does cause a lot of harm in dogs. It's not tolerated well with them. Elixirs have an alcohol base with a sweetener in them, and a tincture has an alcohol base but is not sweetened. ProHeart is an example of a suspension. An emulsion, so we're going to get into topically administered drugs. An emulsion is a liquid suspension. This one you don't tend to have to shake up because there are little droplets of one type of liquid that are hanging out in the other type of liquid. A liniment has an oil base. A lotion, you all are probably familiar with lotions. It just is a more solid form of a liquid that gets rubbed into the skin. And then ointments, creams, gels, other types of, these are kind of semi-solid forms that may dissolve on the skin. And they'll be a little more creamier than lotions or other types of solutions. So some other dosage forms. It's important to note sometimes how drugs come to us. This is an ampule, and this is a cardboard sleeve that it's being pulled out of. It's a glass bottle. There's a little score there. You hold one end in one hand, the other in the other hand, and you break it apart. They're meant to be used once. They do not do well with after you open the container, and that is why they're placed in an ampule. You put a syringe needle in there and pull the drug out, and then you discard whatever is left. They're not meant to be preserved any other way. Multi-use vials are things like vaccines that we use typically with large animals. Um, we'll just pull out one dose of a rabies vaccine, and then we go down the line and vaccinate all the horses in a barn, that kind of thing, as opposed to the single-use vials, which you guys see when you do our vaccination clinic. Repository forms are things that are meant to stay in the body and dissolve slowly. So this is an implant gun, and it's going in probably the ear of a cow, maybe, and it's going to leave a solid form that's going to slowly dissolve over time, and those are called implants. Sustained release forms that are injected. This is an example. This is that ProHeart that I showed you before. I don't know that this is out there as much, but I every time I look for it, it seems to be there and available. It is a heartworm medication that is an injection, and it was meant as an easy way to go for owners. They would just have to come in twice a year. That's why it's called ProHeart 6, good every 6 months. It had some skin reactions, as you might imagine, once it was injected under the skin. So it was pulled off the market for a while, but then it seems to appear back again. Um, that is a sustained release. Lastly, extracts. Extracts are made out of plant and animal parts. They are not, because of that, they are not quite as well controlled as drugs that are synthesized or manufactured. The quality control is a bit less on them, but we do use them for certain conditions. Thyroid medication is typically made up of thyroid tissue, as an example.